Benign but annoying skin lesions is one of the most common reasons that patients will come to see me in the clinic, and there's a long list of different lesions which patients will come with. One of the most common is seborrheic keratosis, which is a warty growth. It can be a brownish lesion. They can occur anywhere on the body. They are completely harmless, but they can be annoying and they can get irritated. And when patients are concerned by them, we can remove them by different methods. Commonly, we might use cryotherapy, which means we're spraying them with liquid nitrogen and they'll fall off. Sometimes we might inject local anaesthetic and scrape them off flat with the skin surface. Sometimes we might use laser treatments. Actinic keratoses are areas of sun damage. They usually appear as roughened patches on the skin surface. They are not cancerous or precancerous in themselves, but they do, if you have actinic keratosis, it does slightly increase the risk of developing other skin cancers. So often it's a good idea to treat them. When we're talking about the treatment for actinic keratosis, it depends on how many there are. If it's just one or two, then freezing them with cryotherapy can be a good idea. If it's a larger number, then cream treatments can be effective, but they do have a bit of downtime. Or a treatment called photodynamic therapy, which involves applying a gel to the skin, sensitizing the abnormal cells, and then shining a powerful special lamp on which targets the abnormal cells in the skin. Harmless moles are often lumpy moles. They have no real worrying features when we're examining them, but they can be very annoying for patients. And these can often be removed just by shaving them off flat with the skin surface. Usually leave a small flat scar, same colour as the skin, and generally a safe and straightforward procedure. Lentigines or freckles are brownish marks on the face, usually seen in areas of sun exposure, so definitely on the face, but also sometimes on the backs of the hands or the arms. Again, they are harmless, but it's important that they are assessed because other forms of more concerning pigmented lesions, such as skin cancers, can look quite similar. So I'd say always, if you are having treatment for a lentigo or freckle on the face, it'd be worth getting it checked. Treatment options or laser treatments, pigment laser is very good. Intense pulse light can be effective as well. Cysts are lumps beneath the skin surface. Normally the surface layer of the skin is formed from dead skin cells, and these are shed into the environment on a sort of regular basis. But occasionally the surface layer of the skin can become embedded, and then the dead skin cells can't escape anymore. And when this happens, they start to collect under the surface of the skin. They form a lump under the surface. This is called a cyst. Now, a cyst in itself isn't dangerous, and if it's not causing any symptoms and it's small, then often it's best just to leave well alone. But sometimes they can be unsightly, and also as they get larger, the risk of infection increases. And if they do get infected, it can be quite unpleasant. So often patients will want the cyst to be removed. This can be done under local anaesthetic. It's a minor procedure. It involves making a small cut over the surface of the cyst, removing the cyst, but also, really importantly, removing the lining of the cyst as well, because if we don't get all of the lining out, there's quite a chance that they will grow back again. So prominent blood vessels or harmless vascular growths called hemangiomas, these appear as reddish lesions or broken blood vessels on the skin surface. They can be treated with vascular lasers, such as the pulse dye laser, the Nd:YAG laser, and they can also be treated with intense pulse light. Viral warts are harmless growths on the skin, also known as verrucas. They're caused by a harmless virus called the human papillomavirus. So actually there's hundreds of different strains of this virus, and we're all exposed to it on a regular basis. And most of the time when we are exposed to the specific strain of the virus, our body's immune system has already encountered it and we don't experience any symptoms at all. But occasionally our body will encounter a new strain of the virus, and what can happen then is that you develop a wart on the skin surface. It is harmless, but they can be very annoying and uncomfortable. And warts will always go by themselves, but it can take weeks, months or years. And if they're not going away, then we have lots of treatments which we can use, starting from simple things that you can buy without prescription, such as salicylic acid topically, through to freezing with liquid nitrogen, surgical removal or laser treatments. Skin tags are little skin lesions which you find particularly under the arms or areas of friction. Again, they are harmless, but they can be removed either by electrocautery, or we just burn them with electric current, freezing them with liquid nitrogen, or shaving them off flat with the skin surface. Lesions that we see around the eyes, xanthelasma is when you get waxy deposits of cholesterol and lipids around the eyes. It's not dangerous, but it can be very unsightly, and it can be treated with, my favourite treatment really is carbon dioxide laser for xanthelasma, but it can also be treated with electrocautery. Other lesions which we see around the eyes as syringomas, these are little bumpy lesions that you particularly get on the lower eyelids, and they represent harmless growths of the glands in the skin. They again can be treated with carbon dioxide laser or electrocautery.